Welcome to my world, the world of a medical laboratory scientist. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with anemia and suicidal tendencies. Well, the knowledge of anemia is very important because we always understand it as shortage of blood, not enough red blood cells or hemoglobin. But the true implication of it is the oxygen, how oxygen and nutrients gets to all parts of the body. But when this oxygen that should reach every cell, because every cell demands oxygen, just like we also cannot live without oxygen. Once there is no oxygen, then life is short immediately. But in a situation where you are anemic, you are depriving some tissues, some cells of this oxygen, but you never know. The implication may be worse than those that what we call anemia, that you feel dizziness and stuff. It may be more than that. And one of the things that has been discovered is that there is anemia in all depression. Almost every depression that is found, there is a link between anemia and depression. Now, a further study is now showing that there is a probability or a very strong correlation that anemia and suicide, though suicide has so many causes, but anemia is now being pinpointed more or less as one of the causes of suicide. If we can be able to do this, then one can easily be testing people who are showing these anemic conditions to know further they could become have that suicidal tendency. But as we go on into the slide section to gather more knowledge on this topic that I've chosen, just press the like, click the like button, subscribe, and more knowledge would come your way.
The outline: objective, introduction, anemia and depression, anemia and suicide, lab diagnosis, prevention and recommendations are just what I shall be treating. The objective: to expose some research findings on anemia and depression, the link of depression with suicide, and how anemia is implicated in suicide. The introduction: anemia is a condition in which the number of red blood cells or hemoglobin concentration within them is lower than normal. The hemoglobin in the red blood cell contains iron in the ferrous state to transport oxygen as oxyhemoglobin to tissues and cells of the body. If there isn't enough iron, there will be less hemoglobin, thereby resulting in anemia. Only 2% oxygen is dissolved in plasma and transported as such. So it just goes straight into the alveoli. The capillary will not take it to some of these cells. The most commonly recognized causes of anemia are iron deficiency and malaria. It mainly affects children and women. Suicide is a social health problem worldwide. Africa has the highest suicide rate in the world, according to the WHO, driven predominantly by depression and anxiety. Should there be the case that Africa has the highest rate of suicides amongst the continent of the world, then it is logical to conclude without much effort that anemia is a determinant of suicidal tendencies, especially as WHO says Africa region has the highest prevalence of anemia in children under 5, with 60.2% affected. It's just like saying all the children are affected. Africa and Southeast Asia are most affected by anemia. In any case, we can't be talking about depression or suicide in children under 5 years of age. But let's talk about anemia and depression in adults. Liquid and Stelzer mentioned that the depression is a sign of anemia. Before you come to that conclusion, it means it has been examined. It's no longer a symptom, but a sign. Beard et al. Showed a close correlation between depression and iron deficiency anemia after pregnancy. Individuals with a sickle cell disease may be at risk for depression, which has been evaluated in a study by Generate et al. Iron deficiency anemia is a common type of anemia that is strongly linked to depression. So these are all research works, so many, uncountable. A growing body of literature has investigated and shown a relationship between anemia and depression in older adults. Corona et al. And the list is endless. As stated in the objective, the effort I am trying to put in is to see the implication of anemia in suicide. So it is not more of a research confirmation, but some studies have been able to link, to correlate this. So a study of serum ferritin, folate, vitamin B12, red blood cells count, hemoglobin, all these are just parameters that one can use to measure the level of anemia. Significantly is lower in late life depression patients. These are people who usually are seen to commit suicide. So they take those who have attempted suicide before and compare them with people who have never done that and found these values low in them. In addition, reduced serum folate and vitamin B12 level in patients may have some effect on suicide attempts. Another study looked specifically at folic acid in a sample of 586 patients studied in University of Chicago and found that 44% reduction in suicide attempts and intentional self-harm was the discovery, that is the finding, after giving these people who are deficient in folic acid. Folic acid is one of the substances that you really help to boost one's hemoglobin. For accurate and reproducible results, collect fasting venous blood sample 8 mils. Centrifuge at 3,000 revolutions per minute for 5 minutes. Then vitamin B12, folate, and ferritin levels are tested using the electrochemiluminescence immunoassay, one of the newest methods using Cobos 6000 Roche diagnostics. That's for checking the substances, especially ferritin level, what you might call serum iron. Blood cell count is also, that is when you're now talking of the hematological investigation. You can use 6 months. The 6 months corporation, Japan, to test for all these parameters in the blood. Yeah, recommendation. We must take cognizance of what constitutes the severe anemia and moderate anemia. The moderate anemia, you could consider 10 grams per deciliter hemoglobin, while the severe should be with any measurement that shows 7 7 grams per deciliter hemoglobin, and that should instruct the action one should take. The CDC recommends for children to do their testing too, so that they could boost their iron level. And as such, that should also be the same recommendation, because the iron bioavailability is a problem with majority of adults. The availability of iron, especially in developing countries, is a serious matter. And from research finding, vitamin C rich food alongside iron rich meals is also recommended. And the animal products, meat product, the in product, is very useful to produce, to give bioavailable ions that will be absorbed no inhibitors generally. The vitamin C will help prevent the inhibitors that could prevent this iron being available in the system for use for this hemoglobin formation. There are other information like folic acid intake, supplementing one's meal. Recommendations should also include testing for these various substances and also the level of the blood volume as well as hemoglobin concentration, so that with all these tests one is rest assured that he is not seriously affected by this anemia. Like I had said, the moderate anemia is there, though it still needs for one to always try to have a normal level. And the only way you can be rest assured that you are having that normal level is for continuous tests, probably once in 3 or 6 months, because the red blood cells takes 120 days to mature and to live in the peripheral blood. That's 120, the lifespan in the peripheral blood, 120 days. So one could be doing it every 3 to 6 months, checking the blood cells. If you like my presentation, press the like button, subscribe, and let us help reduce all these problems that if we do our laboratory parameters check, we could always prevent majority of this ailment.